In this video, I shall demonstrate the PGALS method of musculoskeletal screening in children. It is often an OSCE card. PGALS stands for Pediatric Gait, Arms, Legs and Spine Assessment. It is a quick clinical tool which can be completed in less than 2 minutes and so is very apt for a busy pediatric OPD, even before you need a stretcher to transport the child. Just as our age-old traditional practice of Surya Namaskar has 12 steps, so does PGALS also comprises of 16 rapid movements or limb postures which a child adopts and which gives us a fair impression of as to what part of the musculoskeletal system is involved in that child. We begin with asking 3 screening questions. First is, do you have any pain or stiffness in your joints, muscles or back? Do you have any difficulty in getting dressed without any help? Do you have any difficulty going up and down stairs? We then observe the child standing, which is the first step of this process. We observe the child from the back, from the sides and from the front. In this I have put a photo of the back only for reasons everyone is aware of. We then assess the gait by asking the child to walk on heels as demonstrated in this picture or on toes as seen in this picture. Now let us have a quick look on the various videos. We first ask the child to walk on his heels as this. Even though this child is not doing it very properly, he wasn't very cooperative. By this method, we check for ankles, subtalar, mid-tarsal and small joints of feet and toes. We'll then ask the patient to walk on his toes. In this way, we will assess the posture of the foot of the toes of the patient. And we must note the longitudinal arches of the foot simultaneously, the medial and the lateral longitudinal arches. Next, we come on to the examination of the arms as well as that of the cervical spine. In this process, we first ask the patient to hold his hands out straight in front of you. Even though this patient isn't doing very properly, by this method, you look for forward flexion of the shoulders, extension at the elbows, extension at the wrist, and extension at the finger joints. You next ask the patient to turn his hands over and make a fist. By this method, you check for flexion at the elbow, supination at the wrist and flexion at the finger joints. Next, you ask the patient to pinch his index finger and thumb together, by which you look for manual dexterity, pincer grasp and coordination of small joints of index finger and thumb. You next ask the patient to touch the tips of his fingers. By this method also, you look for manual dexterity, pincer grasp, coordination of small joints of index finger and thumb. Then you squeeze the metacarpophalangeal joints of the patient like this. The video isn't very clear and I am sorry for the same. By this you assess for tenderness at the metacarpophalangeal joints. You next ask the patient to put his hands together palm to palm in a namaskar posture. By this you check for flexion at the elbows, extension at the wrist and extension at the finger joints. Then a reverse namaskar. You ask the patient to hold his hands together back to back. By this process again, you check for flexion at the elbows, extension at the wrist and extension at the finger joints. You then ask the patient to reach up and touch the sky and look up. We may see in this video that the patient isn't being able to do so properly. He is not being able to lift his hands at the shoulder or bend his spine properly. By this method, we check for extension at the neck. Neck extension is equivalent to extension of the cervical spine. Abduction at the shoulder joints, extension of the elbows and extension at the wrist. We next ask the patient to put his hands behind his neck. By this method, we check for abduction and external rotation at the shoulder joint and for flexion at the elbows. Ask the patient to try and touch his shoulders with his ears. We again check for lateral flexion of the cervical spine. Ask the patient to open his mouth wide and put his own 3 fingers inside it. This patient isn't being able to do so properly. He was able to put only 2 fingers inside his mouth wide open. So this shows some restriction of the temporomandibular joint movement. Next, we come on to the assessment of the legs and the thoracolumbar spine. So first, we feel for effusion at the patella, which can give us a fair idea of the effusion or arthritis at that joint. We next look for active movement of knees, flexion and extension. Here the examiner is first explaining to the child and then getting it done. We next look for passive movement of hip, that is flexion and internal rotation. This is internal rotation, this is external rotation. We finally ask the patient to bend forwards and touch his toes straight. This patient isn't being able to do it properly, so we re-instruct him if at all he has not been able to understand the instructions properly. But there is some limitation of the flexibility of the thoracolumbar spine. We finally document our entire findings in this format. This I have taken from ResearchGate, and we put 3 screening questions and our answers in front of the same initially, and then we document our findings of the appearance as well as the movement of gait, arms, legs and spine. So coming to a quick recap, we begin with asking 3 screening questions. Then we mainly look for 3 aspects of clinical examination. First is gait, next is arms and cervical spine, and finally there is legs and thoracolumbar spine. While examination of these 3 aspects, we must be sure to remember that we must look for discomfort or redness at the level of the joint and on patient's face, feel for temperature and tenderness in the local area, and assess for restriction of movements if any. Finally, we document the findings. Thank you so very much for a patient listening and watching, and hope you liked the video. Kindly do share the video for maximum benefit of all. Thanks a lot.